Good workout. Ow. That's what happens when you're tired. These ankle sprains will slow you down every time. What are they? What causes them? How do you get better? How do you get treated? And what's the prognosis? Join me to find out. Meanwhile, I'll take care of this. Hey guys, I'm Dr. Nene, a US trained cardiac, thoracic, and vascular surgeon and a general surgeon. As a healthcare innovator and a health tech innovator, I want to empower you to your best health ever. On this channel, we will share evidence-based medicine from all of us to you through our experiences and training about health and healthcare. The goal is to help you make informed decisions about your own health as well as that of your loved ones. We're here for you, so don't hesitate to reach out. Today we're going to be talking about ankle sprains. Everyone's had them and they slow you down big time. And if you're a new user, subscribe to the channel, hit the big like button and share button so everyone else can see it, and let's start a dialogue together. Remember, all of the evidence-based literature which this is based on in the description section of this talk. So let's start. The ankle joint's very interesting. It consists of the tibia, which is the big bone in your lower leg, the fibula, which is on the outside of it, and the talus. And then these are reinforced with what we call ligaments, which are fibrous tissue, which hold the joint together. Over that, you have a wrapping of muscle and tendons, which help that joint move and move your foot up and down. The ankle joint typically has 2 degrees of freedom, but it has, which are up and down, but it also moves side to side a little bit. The problem results in when you sharply twist an ankle inwards, meaning the foot twists inwards, and you do damage to what's called the deltoid ligament on the outside of your leg, going from the fibula to the talus, which is very vulnerable. So what happens next? The symptoms of an ankle sprain are swelling, bruising in the area, extreme tenderness, and inability to bear weight. And they can be graded from grade 1 all the way to grade 3, where 1 is a very mild sprain resulting in micro tears of the ligament or tissues, and will be associated with some swelling and pain and mild ecchymosis or bruising. In general, these get better very quickly as long as you follow the principles, and within 7 to 10 days, you're back on your feet, slowly but surely. Grade 2 has partial tear of one of the ligaments and damage to the surrounding underlying tissue. And that will be associated with much more swelling and more tenderness and takes a little bit longer. And then finally there's grade 3 where you get a complete tear of the deltoid ligament. And in the process of that, you may even have some instability in the joint. So then the question is, when do you go in to see the doctor? And what do you do when you get it? In most cases, it's during a sport or during running or during an activity on an uneven surface or on heels or on other things. And the immediate action is to get off that leg. So get some support, find a friend, get some way to get home. Once you're home, there's a simple principle on treatment. It's called RICE, rest, ice, compression, and elevation. The rest means you stay off the leg for as long as you need to. When you can't bear weight and it's tender, it's not ready to be hopped onto. Ice for the first 72 hours is optimal, and in the first day, critical. And I would say that you put it on for 20 minutes at a go and then leave it off for a period of time, and that can be done 3 to 4 to 5 times a day. Make sure you don't do it at nighttime, and make sure you wrap the ice pack or whatever you're using so you don't get any frostbite or blanching of the skin. The third thing to do is compression. And I'm going to show you in just a little bit how to wrap it properly. What you're trying to do is slow down the hematoma or the bruising in there and stop the bleeding so that the fibrous tissue can start to heal. And you don't want to have it so tight that your blood flow is cut off, but you want it snug enough that the tear is reinforced. Now, depending on the grade of tear, in the grade 2s, you'll often put it in an air cast, and in a grade 3, you'd probably cast it. Very rarely do you need to have it operated on. Finally, elevation. If you can elevate the leg above your heart level on a couple of pillows in bed, or on a couch or on a lounger, you're more apt to have less swelling. And so the idea is to keep it elevated so that the swelling doesn't make it swell up like a pumpkin, and then it takes longer to heal with all that extra water in the subcutaneous tissue. So RICE is critical. What else can you do? Obviously, crutches or staying off it is critical, and not walking on it. Then the next thing is non-steroidal anti-inflammatories in the way of naproxen or Motrin or some of the over-the-counter things. Now, there's a little bit of a debate on that because some of the fibrous tissue heals by macrophages and different elements going in, cleaning up the damage, and then putting down more fibrous tissue. And some of those get blocked by the non-steroidal anti-inflammatories. But in most cases, people suggest that you want to reduce the swelling initially and deal with the pain. And that works very well with non-steroidal anti-inflammatories, which are over the counter in most cases, meaning you can get them at any pharmacist. Finally, the question is, when do you go in to see a doc? And the answer to that is, if you absolutely can't bear weight and it doesn't get better for a day or two, you need to see the doc. Why? Because after a careful examination to see if you have laxity in the joint, meaning you have a full tear of that ligament, or if you have severe swelling where the numbness or tingling is happening in your feet and not going away, or if you see other changes in the leg where the skin is peeling or blanching, that is an absolute indication to go see a doc. What are they going to do? Chances are they may get an x-ray. In the worst case scenarios, if they need to do any type of intervention, they might get an MRI or a scan on this leg. Now, are there any cases where you operate? Very rare. But in cases where you have full dislocation or laxity, that would be a case where they would go in and do something. But almost very rare to see it happen that way. What can you expect as far as the treatment goes? In general, the mild sprains will get better in 7 to 10 days. And generally, if you stay off it, wrap it, elevate it, ice it, and basically watch it, it will heal. With the moderate to severe, it takes longer and can take up to 4 to 6 weeks in some cases, particularly with the severe. Other things the doctor may recommend after it starts to heal is to increase your motion and start to rehab you from this injury. How do you prevent ankle sprains? So you're asking me, it's always about acute care versus prevention, early recognition, early treatment. In ankle sprains, there is a way to prevent them. The first thing you can do is be careful on uneven pavements, because that's where your foot will buckle under and give you this type of injury. The second is, particularly with heels for women, there's a high risk that you can twist an ankle. And so be careful about the height of your heels and be careful where you're going and don't get into trouble. The third is you strengthen the muscles and the areas around your joint, you'll be better able to adapt to uneven surfaces as well as be able to move around without any issue. The fourth is flexibility and making sure that you stretch and warm up, not in that order, usually warm up and then stretch and then cool down properly after a workout. And so these things will prevent you potentially from having this type of injury, but nothing is foolproof. And I think in my career as an athlete, playing tennis, running track, doing all these things, I've had my share of ankle sprains and they do slow you down. The good news is the prognosis is great. It will certainly hurt, it'll certainly be swollen, but over time it'll be fine. So I think this kind of goes through the basics. We put the links in the description in the video. I would love to hear from you guys to give me your experience with ankle sprains, because I bet you 10 to 1 every single one of you has had one in your life. And as always, if you like what we're saying, hit the like button. Don't forget to subscribe so you get the next latest videos coming, and we got a lot of good stuff coming. And finally, share this with everyone so that they can start a dialogue, and this will help them as well. Because the idea is to pay forward, if you will, and spread the knowledge and help people to take care of themselves and empower them. Anyway, thanks for joining us and have a great day. And remember, if you're a new subscriber, be sure to slam that subscribe button so you can get more videos. Also, tell us in the comments what's your first experience and when did you first sprain your leg, if you did, or if you have any family members or others, and what your experience with that. I'd love to hear about it, and I'm sure everyone else in the audience would. Take care. Talk to you soon.